So technically, the question asking what of the following is the most significant risk factor for patient cancer result? So we know the patient have cancer. Okay. So what of the following answer choices increase the patient risk for cancer? Was the age of menarche increase the patient risk for cancer? Was 17 was 17 related? So why the age of menarche relate or not related to the patient cancer risk?
In this case, it's not related because 17 is the late menarche.
Can you explain it in terms of estrogen level? Let's just say patient have nothing, but just tell you the age. So late age related to high or low estrogen level?
I think it's a low estrogen level.
Good, low. Okay, higher age, low estrogen. So patient doesn't have a period until 17. So of course, estrogen level will be lower compared to someone who had period at 13, right, or 12. That's why one of the risk factors for endometrial cancer is age, but patient have to be like really young or have like early menarche, like 10 or something. Good, so A is not a correct answer. What about C? Anyone know if C is related or not related to patient cancer risk in this case?
Why you skip B?
Oh, well, because, yeah. Oh, I want to ask C first. So, why C is related or not related? So if the patient taking estrogen only, we will be worried, right? But if the patient take the combined one, we don't worry about it because one counter the other. So if anyone know the contraceptive, how it works, then estrogen increase the thickness. That's why I talked about menstrual cycle earlier. So this oral contraceptive mimic the regular menstrual cycle. So estrogen increase the thickness, progesterone stop the thickness. So if we take both of this together, no worry about cancer risk. But if we take estrogen only, then we have a problem. All right. What about D? Why abnormal pap smear is related or not related? What's pap smear tell you? What kind of cancer a pap smear diagnose or tell you?
It's related to the cervical cancer.
Cervical cancer, so not worry about it this case. The pap smear cannot tell you if patient have endometrial cancer or not. Okay, why B is related or not related? Do you think B is related in this case? What patient BMI? 40. That is really high BMI. Okay. And do you remember what BMI do to the endometrium? Do you remember why obese and overweight patients have higher, what hormone do they have higher in the body? Estrogen. Again, it's all about estrogen. So the fatter the people with, they have more fat, and fat contain the enzyme that convert regular hormones like male hormones and stuff to estrogen. There's another slide in later in the PowerPoint that give you the demonstration of that.
They can convert from androgen to estrogen by aromatase.
Aromatase enzyme. See, that's a name. Sorry, I don't remember. That's way back in biochemistry. So why tobacco use is not related? I mean, all related. I don't know. You guys tell me why it's not related. Vâng, why do you think tobacco use is related or not related?
Well, I think I'm not so sure about that, but I think it's not related to this case.
Yes, tobacco. Some research actually revealed that tobacco decreased the risk of endometrial cancer. Okay?
Wow.
So
Yeah.
people who smoke a lot don't have endometrial cancer, but don't smoke because they give you other cancer. So smoking is bad in general. So tobacco actually cancer. Interesting, huh? I don't know how that happened, but they say that some research that read say that tobacco stimulate estrogen metabolism, which is breakdown of estrogen. So less estrogen in the body, less risk of breast and endometrial cancer. Okay. All right, so we already know the answer. Since we already dissect all the answer, B is the answer choices because everything else point us toward a different direction. Okay. Now, I'm not saying B is the only correct answer because I know there are other risk factors for endometrial cancer out there. But in this case, based on patient history, B is a correct answer because that's the only thing that points toward the urine bleeding. Okay. All right, that's it, guys. Any questions, suggestions, complaints? You guys can say that anh Lộc speak too fast that you guys cannot hear. Complain that anh Lộc should speak slower next time. Any suggestion, complaints? If not, let's jump through the information slide real quick. I want to show you the thing. Yes, so this is the simplest version of management. The other one too complex. I don't want you guys to see that. But this is the simplest form. If the patient come in with postmenopausal bleeding, see that you can do either one. I'm not saying that you have to do one. You can do either one. They all lead to the same result. Okay? So you can go ahead and do ultrasound, totally fine. You can go ahead and do biopsy, totally fine. But in America, why save the patient? Well, let's save a patient a lot of money and time, but just go ahead and do a biopsy. Okay? So this is kind of, and we don't talk about management because there was thousands of management out there. Surgery, hysterectomy is a way to cure. Just take the uterus out and you don't have to worry about it. Okay, next. So this is why the fat, obesity, and everything is important, increase the risk. So you see that adrenal glands and ovaries secrete the hormone called androstenedione, and the aromatase enzyme convert that to estradiol, which is estrogen. So it's funny because in Vietnam we don't have a lot of fat people, but in America, like every time I walk outside, I see fat people everywhere. I was thinking about endometrial cancer in my head. So, oh yeah, you might have endometrial cancer.
Yeah, not only endometrial cancer. Yeah, not only endometrial, yep. Many metabolic disease.
But then patients don't die from it; they die from heart disease first. So
yeah,
yeah, they don't die from endometrial cancer; they die from heart disease
first. Yeah, or stroke. Mm-hmm.
Yeah, or stroke, something like that. Mm-hmm. I don't know. It's crazy. Okay, the next slide is very fun. I just want to give you actual information that sometimes endometrial cancer is associated with colorectal cancer and ovarian cancer, and we call that Lynch syndrome. Okay, just extra information. You guys can learn this or not, but I don't see Lynch syndrome anywhere. It's very rare. My doctor, my teacher only see one case throughout his 40 years career, so it's not very common, but on the board exam they ask about it all the time. Okay, and you know BRCA is a gene for breast cancer and ovarian cancer, so you guys already learned that in medical school, I think. Von Hippel-Lindau is a very cool thing to see. Again, you don't see that very common. All this syndrome right here is not very common anymore. See? But it's good to know you can impress your doctor when you go on clinical. You can impress them by hey, Lynch syndrome is blah blah blah. I always impress my doctor by hey, you know that endometrial cancer is related to blah blah blah. Yeah, yeah. You can impress them, get them to teach you. This is some clinical pointers. Okay? Know some of this will impress your doctor because most of them don't know those. I'm serious. Like, all right. Any question, guys? That's it for today. I ended an hour exactly, so you can go ahead and leave if you guys don't have any question. I put the mnemonic in the chat. That's a common cause of urine bleeding using the mnemonic. Palm is the palm of the hands. That's how I remember it. Palm, and coin is just a coin. So palm coin is the way I remember why patients have bleeding in the uterus. Okay.
I have questions about this diagram.
Yes.
Yeah. In for this case, for this they said that if the woman come with the postmenopausal bleeding, we can do the endometrial biopsies. And for example, after doing the endometrial biopsy, we receive the result that this is a benign. Benign is mean that is normal or it's not maybe the activate of the endometrial, not the malignant. So I want to ask you, can you believe this, or do you have another test, or just believe in the endometrial biopsy?
So the guidelines say if it is benign, then we just follow up in 6 months.
Even
So
though
we check
the TV, even though the transvaginal ultrasound say that the endometrial
Yes, even though if the thickness is more than 4, usually probably due to hormones imbalances that may cause hyperplasia of the endometrial wall, and sometimes this can increase the thickness in the endometrium. So that's why if the benign result come back or nothing come back, we usually go ahead, according to the guideline, we usually go ahead and follow up in 6 months to see if the patient still have persistent bleeding. Now, if the patient have persistent bleeding after the benign, then we go ahead and do another biopsy because now the cancer may develop. So that's why we use close follow-up. If the patient have persistent bleeding and have problem with that, then we continue our management. But for simplicity, we let the patient go with a benign result, and we just closely follow up with them. Sometimes hyperplasia can be a cause.
Yeah, because I don't have many experiments about the endometrial biopsy, but for the another cancer like solid tumor with the solid tumor, after we do the biopsies and receive the result that it is benign, we can come back and see the clinical and all the other tests. If we have the we can do the biopsy again, because sometimes
sometimes the biopsy result may be bad.
Yeah, because I don't know more about the endometrial biopsies, because with endometrial biopsy we collect a lot of the endometrial epithelium.
Yeah. Sometime over here when they do a biopsy, they do a procedure called DNC, dilation and curettage. So typically they go in, they dilate the cervix, and they use a camera. They see it. Usually we use hysteroscopy. So we want to see the inside of the uterus. The gynecologist check if they have polyps or anything, and then they sample, and then they burn the whole lining.
But
So-
in Vietnam, we don't have the camera. We just
Look like
Yeah, that's
blind biopsy.
blind biopsy.
yeah. Over here, they just take the patient in the OR and they do everything.
So I think it's the reason why we can believe the endometrial biopsy result in this case. But for another solid tumor, like in my measure is the tumor in head and neck. Yeah, sometimes we collect the sample from the tumor and the result said that it's benign or it's not malignant. But we don't believe we can do again as soon as possible. Yeah.
So yeah, if, in the case of endometrial, if the result is benign, you follow up in 6 months or 3 months, depending on your if you're comfortable letting the patient go for 3 months or 6 months, yes, do that. Technically, research data say that 6 months is a good time to come back to check if the patient still has problem. Yeah, usually 6 months.
Okay.
Yeah, because cancer can develop in 6 months, I guess. But usually, if the result is benign, we just think that hey, patient may be on hormones or like hormone imbalances or something going on that cause the endometrium to become thick. So yeah, thank you for your question. It's very contributive to the case. And if everyone don't have any question, yeah, we done. You can leave. And this week marked the end of OB weeks for me because I think I'm doing too much OB. That people say that hey, I'm an OB doc. No, I'm not. I'm totally not interested in OB, but I just have a very, very major experience with OB. So yes, I'm not an OB doc, and I don't really like OB that much, but it's a really cool topic. Okay. If anyone don't have any question, yes, we done next week. I may do another one, but maybe Miss Tung or Dr. Tung will do that. Well, thank you for being as your host. Appreciate your participation. It's really fun to talk to all of you, and I learned a lot from all of you.
Yeah, we will.
And remember, English is speaking, practicing, and nobody will be good at it. Even I'm not good at it. But as long as you keep practicing, it's like medicine. We're practicing, we get better. So okay. So that's why people say practice make perfect. So just keep practicing, and if you don't know anything, send me a message on Facebook, and I will answer it. If not, we're all done. Thank you.
So okay, we will.
Nobody want to leave.
Nobody wants to leave. Okay.
Actually, want to leave.
Actually, we will do the series of the talk about cancer in just maybe a few months. I don't know until we can feel like we don't want to do any more about the cancer. But
what cancer you guys want to do next?
Yes, I'm asking to. So what the topic you guys want to do next? We will looking for about is some information about this. We did many cancer, right? Breast.
See, I even have my note next to me to help me with. So that means that I'm research about this topic really well.
Yeah. So anytime when you guys show any topic about this, I hope you can have a little bit information at least.
If you feel confidence, you can talk to Dr. Tung about being the host too.
Yes. Be like this. Be confident and
yeah, maybe you should host one case, and then your English will suddenly get better.
Okay. So any idea for the next topic you guys want to do? I will take a look at it first. We did lung cancer, cervical cancer, breast cancer, so the endometrial cancer, and what we did? I forgot.
Colorectal cancer.
Colorectal cancer. Yeah, sorry. I need to.
You do that too.
What else we can do more?
There's so many cancer. Oh my God.
When you want to suggest me idea for that?
Well, you guys want to do Hodgkin lymphoma?
Oh yeah, Hodgkin and
non-Hodgkin
lymphoma.
lymphoma.
Yeah, I also do leukemia before. Yep.
Leukemia. I don't know anything about that. Lymphoma is interesting, but it's really hard. It's like super advanced.
Yeah, leukemia is very difficult. It is another kind of the cancer. It's not a tumor.
Leukemia, yeah.
Yeah.
But we will do the non-Hodgkin lymphoma, okay?
So bone cancer.
What?
Cancer.
Bone cancer. You want to do
Bone?
bone cancer?
Bone is
Bone?
it's okay. I can do it well. Bone cancer. But
Maybe
it
we
depends.
should make Miss Thương do bone cancer or something.
Okay, let's see because let's see who will be the next host. I'll still consider me or another. Just
All right, guys.
secret
Any
and yeah.
suggestion? Just shoot a message to CocoMed and we'll take a look at your suggestion.
Yes,
and,
yes.
We'll think about it. So you guys can leave now. I won't take too much of your time. I know you guys have to study or go watch TV or do whatever. It's late. I'll go sleep. So enjoy your night. Have a good night and thank you for joining.
Yes. Thank you so much. See you guys next week. Okay.
Thank you everyone for the
Yeah. Have a good night.
What is it?
Nobody want to leave.